All right. Well, welcome everybody to today's Arvigo Mayan Abdominal Massage workshop with Caitlyn Nguyen. I just wanted to introduce Caitlyn, give a little bit of background for those of you that have not met Caitlyn. Caitlyn has been with us here at Revive Chi for 4 years, or almost 4 years. I feel like I've known you forever, Caitlyn,
Yeah.
and has been such a huge contributor to the care and just such an amazing addition to our team. So we're always so thrilled when we're able to co-treat with Caitlin, whether it's in the space of fertility, pregnancy support, postpartum, or even through other phases of a woman's life, whether it's perimenopause or menopause. Caitlin has been doing some amazing work with our patients. But to give you some background on Caitlin, she has extensive training in various massage modalities, both within and outside of the realm of women's health and fertility. And within women's wellness, Caitlin performs pre and perinatal massages that include techniques for relaxation, deep tissue sculpting, lactation support, labor induction, optimal positioning, C-section scar work, and bereavement. For fertility, Caitlin is a certified Tul'Ix practitioner to
Tul'Ix, actually.
provide Arvigo Mayan Abdominal Massage, which is an indigenous bodywork practice that supports reproductive health, digestion, and uterine positioning, which can help support women trying to conceive both naturally and via assisted reproductive treatments such as IVF. Finally, she provides lymphatic drainage and Reiki treatments to support detoxification and energy balance, which is often helpful to clear out the body post egg retrieval and to prepare for embryo transfer support. Outside of women's wellness, Caitlin provides therapeutic massages which focus on pain management and postural efficiency in the body using structural organization techniques similar to Rolfing, myofascial release, and dynamic cupping with some TCM influences from Zen, Shiatsu, and Tuina acupressure. For relaxation, she provides the classic Swedish circulatory oil massage. Caitlin is trained in oncology massage as well as and can provide modifications if a person has a history of cancer. So, Caitlin, thank you so much for presenting again. I know we had that in-person workshop, and I just thought it would be so great to be able to also offer it virtually for those that couldn't join us in person. So, I just wanted to start off by asking you a little bit of background about Arvigo Maya Abdominal Massage, like how it originated and like where it all began. A little
Yeah,
bit of
that's
a
that's such
history
a
for us would be great.
yeah. Like I'll obviously the history of it can be quite long, but to kind of put it in a nutshell, so this work is actually based off of the work of a lot of the like Yucatec people in like the Mayan Peninsula area. So it's like a combination of many different indigenous people's works. They're kind of like medicine people are healers in their own villages, and the term usually is like curandero or curandera. Um, and so like each village usually had a curandero, curandera. And then basically that medicine person would provide care for their village. Um, Dr. Rosita Arvigo was a naturopath doctor who came from the US who studied with one of a particular village's curanderos. So she came to Belize and studied with Don Eligio Panti. So Don Eligio Panti is very important to this work just because um, he and the combination of all the other curanderos in the area helped kind of shape this type of work that then has been able to like come to the Western world, which is where we have a lot of that. The work still exists like, often in traditional like sobadero. I think it's sobado, the sobada. It's a lot of the time like if you speak to someone who's like of Mexican or Hispanic background, like they'll do the sobada massage. A lot of it is based in that. So it's a lot of indigenous roots in the work. But the name that you see it as, Arvigo Mayan Abdominal Massage, often comes from the way that Dr. Rosita Arvigo brought the work to the Western world. And nowadays, there's another name, which is when you were mentioning in my bio that that there's indigenous words actually now in the name of the organization. So now the organization who teaches and certifies for Arvigo Mayan Abdominal Massage is Tul'Ix Indigenous Arts. So it brings it back often now to the roots of indigenous peoples who created this work. And Tul'Ix is the name of the word for dragonfly. So it's the dragonfly is very symbolic in their work, and you'll see it appear everywhere. And so I'm a Tul'Ix Indigenous Arts practitioner performing Arvigo Mayan Abdominal Massage. And what's really important to know about this work is that the massage aspect of it is actually just one part of the entire like concept of their healing practice. So what we do in the clinic, for me as a massage therapist, I'm doing the actual physical body work portion, but a lot of things are intertwined with the work. There's like spiritual healing, like prayers, like active prayers with their Mayan gods, and there's also like castor oil application. There's like bone closing ceremonies, the use of faja, and also like yoni steaming or like use of like herbs and all of that. We can talk a little bit later about how that shows up today and how it is, because I don't know if you're expecting to go to your massage appointment and being like, are we yoni steaming today? So actually, it'll actually be a little different. We can explain a little bit later. But the whole concept of it is that it all exists in the practice of the medicine for the Tul'Ix Indigenous Arts, Arvigo Maya Abdominal Massage. And then the bodywork portion of it is a special part that I get to share with you guys when you come in. And what's really wonderful is you always come in leaving with the self massage tool. So
Mhm.
I actually teach you how to massage your own abdomen, and that is something that you can use all the time. Like no gatekeeping. Like you can literally do this all the time. And depending on if you're doing fertility treatments or anything or sensitivity around your period, there are times that we can, rest and not have to go so gung-ho on it, but we'll go into more detail with that, like during the visits.
Well, that sounds so wonderful and comprehensive. And I love that you're giving patients a tool to take home to continue the course of care for themselves. So that's really powerful to be able to have like some self-care tools just to be empowered to do those treatments on your own. So how would you say that Arvigo Mind Abdominal Massage differs from like your typical massage, what most people are used to in terms of like Swedish or therapeutic?
Yeah, that's a really good question. So the massage portion of it, it focuses on the abdomen and specifically the area in front of the uterus. So it's all external work, so it's not internal work. I'm not a pelvic PT,
Hmm?
so it's like
Thank you for clarifying.
yeah. So it's external work in the abdomen. And the area like right above the pubic bone, which is like the area where the uterus will usually show up. It's kind of, she's like right behind the bladder, right there.
Mhm.
And then there's also work in the low back, sacrum area, tailbone. And so it's usually as a treatment, an anterior and posterior protocol, so the front and the back. And so you really are focusing on that main core part of the body. Like there is some touch along the back, sometimes along the legs, but the like majority of it is centered on this area. So that's where it's a little different than other treatments because
Mm.
Swedish will be like full body or like a therapeutic is like targeted work, specifically looking at muscles. Like the lens is very different. So the abdomen of the body is also like such it's the core. Like it's the core, It's not just a core part of the body, it's the core. And there's a lot of muscular tension and like emotional holding and guarding that exists there. And often now massages don't really touch the abdomen. Maybe like 30
Mhm.
years ago it used to during a relaxation, but like that's a whole part of your body that doesn't get the whole combined part of like muscle relaxation and
Hmm.
all the benefits that come from body work in those areas. So it's like a very wonderful specialized massage just for that area.
I love that. And you're right that I'm just thinking about some of the massages that I've had, recently more like at spas. I don't ever think that they go over the abdomen area at all. So it's nice to be able to have that area, that sacred space tended to in such a like just special, unique way. And so thank you for clarifying that. So how would you say this type of abdominal massage influences the uterus, the pelvic organs from a physical standpoint as well as like an energetic perspective? Because it seems to me that this is beyond the physical. Like we're looking at treating at a deeper level for patients.
Yeah. Well, so physically, so there's a portion of the intention for the massage is like efficient or like proper uterine positioning. So it's not to say that like a uterus being in a specific spot is necessarily like improper, but it's more of if there's a goal that you're looking for, like for example, if you have urinary incontinence.
Hmm.
If your uterus is pressed up against your bladder and maybe like shoved up to like the right side of the corner of your pelvis, that's going to cause you to need to urinate more often. And so the massage will manipulate the uterus to come back to center and maybe push her a little bit further away from pressing up against the bladder. So in that way, like that could help with reducing that tension happening there, and it'll affect the whole rest of it. So there's a lot of the strokes that will happen in the lower abdomen around the uterus will affect the way she sits in the pelvis. I always kind of use this example, but if the pelvis is kind of like a bowl, imagine your uterus is like a little balloon that sits in it, and depending on if you're on your period or not, she'll be a different size. And there's these little ligaments that attach her to the front bones of your pelvis and the back bones of your pelvis, which is like the sacrum. And if you're manipulating her, she's kind of tugging on those little strings and she's shifting. And it can also help with reducing like the pain if you have any pelvic pain in that area. And it'll like almost ask her to be more movable in general because she's not like we don't just like pull her and then she stays there. She's now like, oh, I'm a little bit free. So she has space to kind of move, and she can be in a position that will help um, you like not have certain symptoms, whether it be pain, discomfort, all of that. So it's kind of like how working the uterus asks for change to happen in the pelvis, and so many organs and things are going on there. There's kind of like a ripple effect as well.
Right. It sounds like it would be a great complement to pelvic floor therapy.
Yeah,
And,
great point.
for other treatments that are specifically focusing on bladder issues or prolapse or pelvic
Mhm.
pain. So I'm
Yeah.
excited for us to be able to continue to work together with acupuncture and then pelvic floor therapists as well.
Mhm.
So as a fertility specialist, I'm going to ask you questions about fertility. No surprise. So how can Arvigo therapy support natural fertility?
Well, so the work around the abdomen. Oh, I just realized I totally forgot to talk about the like emotional part of it.
Hmm.
I
Yeah,
can kind of
let's
bring
go
it
back.
in.
Let's segue back and
Yeah?
talk about
Okay.
the
Well,
emotional aspects
I
of
guess like
treatment.
so the emotional part of it is more of like it depends on where you're coming from, right? Like usually if you think about the posture of a person who's trying to protect themselves, you are automatically trying to go into like fetal position or like almost like in a protective posture to guard your vital organs. And those vital organs are right there in the center of your abdomen, you know? And so if you can imagine a lifetime of never having touched there, like, there's sometimes emotional or physical things that will kind of show up in the abdomen. Sometimes you like don't even know. You're just like, oh, I have a tummy ache, but it's whatever, you know? And then you like actually poke around the abdomen, like, and like are receiving the massage, and you're like, whoa, I don't know why that was so tender.
Hmm.
And there's just you don't often pay attention to those things. And so often emotions can come up. And if we're linking this to fertility, or even if fertility is like like no longer something that you have as a chapter of your life. Like if you're in perimenopause or like menopause and you've already had kids, for example, like that's still something that you can work through because it'll also help bring up emotions around maybe your birth or a C-section or, like there's very specific um, emotions that can happen during all these different phases, whether you're like in your prep for, having a child or whether it was just, like menstrual cycle related pain and then pregnancy and then perimenopause, like, postpartum, all of that. It's like this entire like realm has possibility for emotional buildup. And so being able to receive that work can also physically reduce all the tension that's in there, ask for opportunity for it to be released, and also your self-massage. That's like kind of bringing into your own hands
Caitlin, you're
your
cutting out a little
healing
bit. Caitlin.
for yourself and your body. Oh, my internet connection is unstable.
Yeah, sorry, would you mind repeating what you just said?
Yeah, so like when it relates to fertility or like your stage in pregnancy, postpartum, perimenopause, um, all of it connects because that's an entire spectrum of emotions that you can have. Even if you like weren't even trying to conceive, just being a woman with her menses is enough storage for you to have stories that you want to release or, like take ownership of, especially with your self-abdominal massage. Like all of those emotions can be worked through. And that's something that like I would help facilitate in the room, but also something again with the tool that you can use at home to kind of rewrite your own story or like come to terms with things that you need to. So that's more of like the emotional part of it. And yeah, so that's emotions.
Yeah, that's
Um,
beautiful.
yeah. And so fertility wise, it's great because in the abdomen, like for those who've like seen me for lymphatic drainage, you know that like we always do abdomen work whenever we're doing lymphatic drainage. Of
Hmm.
course, we always start at the neck with the terminus because that's the beginning and end of the lymphatic system. But abdomen work is so specifically important because we have 200 to 300 like deep lymph nodes in there. So if you're getting a massage, if you're literally having a massage or even rubbing your tummy yourself for like 60 minutes or longer, can you imagine how much lymph is flowing?
Hmm.
Imagine how much digestion support is happening, how much blood circulation is coming through, and areas that were like cold or like not moving as well, because I imagine like almost like a dusty corner in the house, like little cobwebs. You're like, I didn't notice that there was something going on here. You're able to sweep all of that away and like invite more of like literally your body's own healing processes to come in. Like cells will be like, this is the corner I haven't been in. Hormone regulation, like being able to circulate blood back to these areas is inviting and asking for your body's own cells to come in and like do the work that they need to do to clean up, to heal. And lymph is part of that process to
Hmm.
help clean out different things like stagnation. It helps with chi. I'm sure you can talk a lot about the way like the abdomen can release chi. Also like physically like fascial restrictions, like sometimes they're in the corners, like where the uterus has been kind of pushed up in it for like a long time. Like you'd be surprised how many times I've had a patient who had like their uterus kind of like given extra space that they're like, whoa, I actually felt how shoved up in the corner she was. And it
Hmm.
feels different. Like there's
Yeah.
there's different spacing in my abdomen based on like where she is. And all of that is kind of like a beautiful like concoction or a combination of ways to help promote healing and like prepping the uterus for like fertility for conception. So like if you're trying or if you're doing like IVF, like if you're doing like natural fertility or like IVF, it's a great time to be able to do it. It's like great to start like at least 90 days prior to like like any like IVF treatment, for example, just because it's nice to prep the whole area,
Mhm.
especially with lymph and everything too. But it's like there's just certain periods where we're not like going at this aggressively. Like there's like your ovulation and luteal phase if you're actively trying. It's like a time of rest. It's like a time to just let your body do what it needs to do, but knowing that like there's avenues for you to like help tend to yourself, literally tending your own belly or receiving care in that way. So it's like perfect for fertility. It's well known that Arvigo Mayan Abdominal Massage is great for fertility.
Yes, that's why I was so excited when you got your certification in it. So, of course, my brain is already thinking about like treatment protocols and, what can we design together? But let me just ask you about timing of treatment first.
Mhm.
So, in an ideal situation, obviously, we all talk about preconception care, right? And
Yeah.
being able to work with patients 3 months before they even start trying. That's ideal. But in the real world, a lot of times our patients are coming in to see us while they're already trying, or maybe they're in the middle of an IVF cycle, or unfortunately, maybe they had a cycle that didn't work out.
Mhm.
So, in those types of situations, what would you say? Um, like if we were to just take a typical cycle, let's just say a menstrual cycle, are there
Mhm.
certain times of the menstrual cycle that you would recommend to receive treatment? And are there
Yeah.
times and when are the times of rest? You said luteal phase, like post-ovulation. But like in
Yeah.
the follicular phase, how many times ideally
Yeah.
would
Good
somebody come
question.
in for treatment?
Yeah. Well, so this is if you're actively, trying to conceive. So I would say like follicular stage is the best. So like right at the end of your period, and then maybe give like if you know when you're ovulating, maybe give it like a 2 to 3 day break. So that like week and a half-ish, week and a half-ish, you can get physical like Mayan abdominal massage treatments like 2 to 3 times. But also like know that like the self-abdominal massage can be part of
Hmm.
that too. So
Yeah.
like getting a treatment like once or twice in that like week and a half or 2 weeks or ish, like you can get like one a week or something, and then you can be doing the mind abdominal massage at home for yourself every day if you
And
want.
this is the follicular phase up until ovulation.
Follicular phase,
Right.
yes.
Okay.
And then once you're around ovulation, if you're actively trying and you're going to luteal phase, it's time to give the body a rest.
Hmm.
And then if you are reaching your menses, like your menstruation, um, typically they say like about 5 days before menstruation better to like give it a break, but also it doesn't mean that you can't get the actual physical work. We just have to be more gentle, more energetic around the lower abdomen, around the uterus, because she gets bigger and can be more like uncomfortable when receiving deep work. So we do very gentle work, and sometimes the intention in the care, especially even when you're on your period, is a signal to your body and yourself that it's safe, even when you're going through like menstruation. So, like, we could do the anterior protocol for the Mayan abdominal massage and do the typical pressure and depth for like the upper
Hmm.
abdomen. And lower abdomen, we can just do like gentle energy work, meditations, anything that sends loving energy to this area as, like you are, receiving. And this is really lovely to do, even like if you are in your active like ovulation or luteal phase, to just do like wonderful, gentle energy sending to your own like uterus. It's not like it doesn't do anything. It does.
I love that. Positive vibes always go a long way.
Yeah.
So, okay, that's great. So for fertility patients, that makes a lot of sense. And what about if a patient's just coming in for hormone balancing? Maybe they have irregular menstrual cycles. They might not be tr they're not trying, but maybe they're
Hmm.
just somebody that has PMS or painful menstruation
Hmm.
or just irregular cycles, or maybe they don't even ovulate
Then it's perfect for them
regularly.
to be coming in like throughout the entire month until about 5 days, before their period. And again, you can still be seen during period. We just do different things softer.
Sure. Yeah.
So all the other 3 weeks, it's very open to
Hmm.
for you to receive like both body work and self-abdominal massage. And like yeah, there's a lot of other things that could be put into practice as well, especially because like, the practice has to do with castor oil packs and like yoni or V steaming too. Like all of that can also be put into practice when it comes to like actively not trying or like perimenopause symptoms or anything like
Hmm.
that.
Yeah.
Yeah,
Well,
like
let's talk a little bit about that because you brought
Mhm.
up a good point for perimenopausal women
Mhm.
whose cycles are very irregular, or maybe even menopausal women where they've not had a cycle for almost a year or over a year.
Mhm.
So what are some of the benefits for those patients?
Yeah, I mean, so the abdominal massage plus other like modalities like using castor oil packs. um, I'm sure everyone has maybe heard at least of castor oil packs, but the castor oil packs are really useful for kind of detoxifying, like the liver, like the organs in the abdomen here, um, which is why we don't typically do it unless we're trying to actively detox or clear away energy, or excess energy. And so like that is useful for needing to like if you're feeling like you really need to like send something through. And like V-steaming, for example, is a way to like warm the uterus, and it's a really wonderful practice with the massage in order to like prep the area because like the ligaments and everything that's happening in the uterus,
Hmm.
they can be warmed prior to even receiving massage, either self or like in clinic. So you could do like a V steam or a yoni steam at home, and that warms everything and preps it for like more movability. Um, with these steams in particular, um, there's like specific herbs and safety protocols for it and ways for you to like not burn yourself and make sure you
Right.
do everything correctly.
Yes.
But actually, as a massage therapist, I won't be speaking too much about it. It's actually, I would refer to like Dr. Yang, or like Dr. Naomi Machimura is another one of our acupuncturists, who have the information on it because there's like safe ways to do it, and you want to be able to know like what herbs are correct for you and the safety protocols. So, that's where usually I say it's wonderful for it to be combined, where like the day before or like the morning of or something of your massage,
Right.
you can do something like that. But it's best to double check with your acupuncturist as well.
Yeah, no, that makes a lot of sense. I think the timing, that's exactly what I was thinking about too, was if you were to steam first, it just kind of
Mhm.
like softens and warms everything up and it starts the blood flow
Yes.
earlier so that I think you can get more results, I think, with the abdominal massage. So yeah, I agree with you. That makes a lot of sense.
Hmm.
So, well, let's talk about postpartum recovery because I know Mayan abdominal massage is used oftentimes to care for women after they have um, their babies and after delivery. So, I'm curious to learn more about that and what are some of the things, what are some of the practices within Arvigo abdominal massage for these women?
Yeah, so it's beautiful to come in for our Vigo afterwards because we're part of like the recovery process for postpartum moms as well. So Um, a lot of things shift even during birth. I mean, of course, during pregnancy as well. So depending on whether or not you had like a cesarean or vaginal birth, the timing of coming in for your care is a little different. So maybe like about 6 weeks or so, like 6 to 8 weeks post vaginal birth, or like 8 to 12 weeks post cesarean, as long as your
Mhm.
doctor's okay with you coming in for care. Um, It'll be good for helping prevent like uterine prolapse or,
Mhm.
any type of prolapse, to be honest, because we're trying, what the work that we does helps with like almost like a pelvic lift type of sensation. And so it also helps stabilize the area of the pelvis. Um, Traditionally, the indigenous healers would use like fajas, which are like these wraps. I know there's like modern versions with like Velcro and stuff, but like fajas are actually really like what's the word? Like accessible. Yes, they're very accessible.
Mm-hmm.
Like you literally just need like a long scarf and you can tie it around your waist. And depending on where you're placing the knot, you can actually help stabilize the pelvis even more. Like fajas are so great for postpartum. And so like that's awesome. Plus, of course, I'll always talk about the lymph. The lymph is really great for healing. Like that's literally your immune cells being kicked into overdrive. So like they're helping you heal. So adding that extra blood flow, that extra lymph in the area, uh, is really healing. And depending on also how your birth went, if you need emotional support, there's bone closing, there's spiritual baths. Like there are literally like I don't think like I've made it as clear that like prayers are a huge part of Arvigo Mayan Abdominal Massage because Donalihio Panti himself always prayed to the plants before he harvested them in his own healing. And it's always the idea that you ask first. You ask for healing that isn't just like it's a plant. It's of the land. It is the water. It is the sun. It is everything that has culminated to make us exist and live and thrive and helps us actively heal. And so before we do this, we ask for the connection, we pray. And so the work itself combines like Mayan prayers and everything to ask yourself to also heal at a level that's deeper than just physical because
Mm-hmm.
it acknowledges your spiritual and emotional state as well for something as crazy as opening the birth portal.
Yeah.
That's why they have
Yeah,
like
I
their
love
bone
that. That's
closing
so
ceremony
cool.
too.
Yes.
And bone closing ceremonies also aren't only for postpartum windows. Sometimes they're necessary to close old traumas where you're still
Mhm.
exposed, you're still suffering from something. And bone closing can really help you come to terms with these things that you just need to close the door on.
Mhm.
So it's a wonderful part of the practice too.
That makes a lot of sense. I mean, it's a very spiritual as well as like setting the intention for your treatments. So I love that about what you said, that the prayers and the intention setting is a big part of the treatment. And so I think it's a good practice for all of us, whether we're with you or doing it on our own, self-care massage on our own, abdominal massage. I think that's an amazing reminder to be able to set intentions for higher healing for ourselves. So thank you for explaining that.
Yeah.
So as far as there's so many things that we see in women's health, and boy, I have a lot of questions. But I was curious about what about conditions like endometriosis and fibroids, and what if patients have had surgeries like laparoscopic surgeries to remove endo, or maybe they had a hysteroscopy to remove fibroids and polyps? That's something that we see quite a bit in our patient
Yeah.
population. Is this a treatment that can complement or can actually help with the recovery? And what's the best timing for this treatment?
Yeah, definitely. Well, if it's any surgery, it's best to wait at least 6 months before you're doing any like deeper work.
Hmm.
But you can always come in for lymphatic drainage. Lymphatic drainage is best in the first 30 days. Because
Did you say 6 months after surgery?
yeah,
And you're talking about laparoscopic.
yes.
Okay, because that's a more complex procedure than a hysteroscopy. A
Yeah,
hysteroscopy is sometimes
usually,
done. I
yeah,
don't know if you are familiar with the difference, but
yeah. It's just 6 months for, yeah, laparoscopic for sure. But
hmm.
like typically 8 weeks post-surgery is best to avoid like deeper pressure, but that's why
Hmm.
like lymphatic drainage exists because that's specifically um for like post-op care because that's super gentle that it works more with the like first 30 days of healing for
Okay, that makes
post-surgery.
sense. Yeah,
Yeah.
so definitely leaning more on the lymphatic drainage
Yeah.
for post-op
Yeah.
recovery.
But
Okay.
it is still helpful because it does move lymph. It's a deeper work in the abdomen versus
Hmm.
manual lymphatic drainage in the abdomen. So depending on like how the surgery is, you just want to be
I'd
more,
imagine it would be really helpful for pre-op, like
yeah,
actually getting the work done before surgery.
yes. Yeah, it's definitely good pre because you are stimulating lymph, you are stimulating the area from your blood. It's already getting sent all the cells to boost immunity and help with recovery. So pre-surgery, it's always good to do that as well, either traditional manual lymphatic drainage or Arvigo. But
Hmm.
yeah, post a little bit different. But specifically for like women with like previous surgeries, endometriosis,
Hmm.
and like hysterectomies and everything, you can actually still receive the work with a hysterectomy. So, because it's still the womb space.
Hmm.
Um,
Definitely.
yeah, and it's best for like actually physically getting through the fascial tension. So, um, because surgery is literally it's invasive in the body, the body may have even subconsciously held or guarding tension and, of course, emotional trauma coming in as well with that. And so being able to confront it gently and in a way that feels at the level of depth that can like slowly work through it, you can actually feel like the tension kind of disappear over time just from physical manipulation of it. It's different than like say a therapeutic or deep tissue massage where like you really go in and like try to like cross fiber and get through old scar tissue and stuff. This area is more tender. So, um, just having the abdominal strokes through the area can release fascial tension. Just know that it's not as like intricate or as like specific to like breaking up something such as like C-section scar work or
Hmm.
like
Right.
like deep therapeutic work. There's
Hmm.
different lenses for it, but it is definitely the helpful way to go about all of the scar tissue and adhesion buildup from
Hmm.
previous surgeries related to all of that.
Yeah, that's actually a big part of the work I think that is beneficial for what you're doing and complementing acupuncture too, because we do have a lot of patients that see us with C-section scars that want to kind of minimize and heal or try to
Hmm.
speed up the recovery process as much as possible.
Hmm.
So, what would you say the top like 5 to 10 things that Arvigo Mayan Abdominal Massage can treat? Like, what would you say? Like, yeah, you have to come in if you have these things. What would you say?
Yeah. Um, Digestion issues.
Hmm.
Digestion issues is very high up on the list, like IBS,
Hmm.
get gas, bloating, all of that, because that can really help you have regular like stool movement and like things that maybe like caught up in there. You can really help
Yeah,
out. So
sign me up.
digestion issues for
Okay.
sure. I would say PCOS and endometriosis
Hmm.
for sure. And then I would say also like any kind of like congestion, like lymph congestion as well. It's different. It's a different tool for it, but it's that congestion can be manipulated in a way that's different than traditional lymphatic drainage in that it has much more of that like blood and digestion benefits as well. Like it's kind of like the lymph and the blood and the digestion support is great because that's all like with the positioning of the like uterus and the organs, the intestines and
Right,
everything.
right. Yeah, that
Um,
makes sense.
and I think honestly, like for me, I think the emotional aspect of it is huge. Um, it's like the connection to your womb. Like I know our in-person workshop was literally called Connecting to Womb, but
Hmm.
it's because like I don't think enough women are actually aware of literally their uterus,
Hmm.
or like the
Right.
womb space, and that is healing in many ways for just women growing up in our world, and being able to connect to the uterus in that way is a way to establish a connection that isn't just you're an organ in my body, and it's like I ask this of you, and
Yeah.
what do you ask of me? It's something that's deeper.
Yeah, I love that. It's a sacred space that needs to be honored. And I think sometimes we not ignore it, but maybe just kind of treat it not with the care and the TLC that it really needs. Okay, so I think we have some questions that are coming through.
Hmm.
So let me see real quick. And you might have answered this already, but when can you have Arvigo during the cycle? Is luteal phase contraindicated? I think,
Yeah, so just to clarify again, if you're doing fertility, it's best to do it during follicular cycle. And once you're in ovulation, luteal, into menstruation, it's best to take a little break, especially your own self-care massage as well. If you're not actively trying to conceive, you can do it in follicular, ovulation, luteal phase, and then maybe closer to your menstrual phase, you're like, I'm going to take a break. So,
Mhm.
um, yeah, it just depends on where you're coming from with it. Yeah.
Thank you for clarifying. Okay, so I'm going to ask you a question about integration, integrative care. So,
Yay.
again, biased because I'm a Chinese medicine doctor, but um, how do you see Arvigo therapy complementing acupuncture and Chinese medicine?
Well, acupuncture and Chinese medicine is freaking awesome. So, that's fine.
You had to say that. I paid you to say that.
Well, so like even within like the network of providers that I'm in touch with Arvigo and Tul'Ix practitioners, sometimes the answer is like go get acupuncture because like acupuncture, I know you can speak a lot to this. It really helps look at the body's entire system with the chi flow. And I'm sure in TCM, the center of the body in the abdomen has a lot of significance.
Mhm,
Um, but it's also the idea that like having care with an acupuncturist gives you most up-to-date information on the best herbs for your body, especially for V steaming, because
mhm,
the care for Arvigo again is very comprehensive. There is a nourishment element to it, which is things that you ingest, and as an acupuncturist, you can speak to the herbs that you can ingest that are safe, especially for fertility or for non-fertility, different phases of your life. The V steaming acupuncturists also have all the information for it, also the herbs that are safe to steam with. Um,
mhm.
and though I can do castor oil packs, you can also do castor oil packs with your
Right.
acupuncture. Like, so if you're coming in for acupuncture and you're like, I didn't have time to do my like Arvigo Mayan Abdominal Massage last night. It's like, oh, do you need a detox? There's some castor oil pack that you can add on to your
Sure.
acupuncture.
Right.
It's a lot of it's actually very like Venn diagram in the center, like literally very shared. Like the only difference I would say is like the manual manipulation part of it, which is, where I am, your high massage therapist.
Well,
And
I'm excited about us being able to treat on the same day. Like if somebody can
yeah,
carve out time to do
yeah,
both, I think that would be such a treat. I mean, luxurious and also so clinically beneficial.
yeah.
So tell us, how long is your typical treatment?
So, Our the bodywork portion of the initial treatment is around 60 minutes. It can be more, it
Mhm.
can be less, but I leave about 105 minutes for the initial visit because about 30 minutes of it is a very detailed intake. Because we're not messing around here. Like this abdomen area, there's a lot of stuff to go through. There's a lot of stuff about family history, like
Right.
even like all the things that your body has gone through. Like, has there been like trauma to the head or the tailbone? Has
Mhm.
there been trauma to the sacrum? There's all these in-depth questions that we ask about for this area because there's a lot of emotional holding as well. So 30 minutes of intake, about 60 minutes or so of the bodywork protocol, and about 15 minutes at the end of the first visit to go over the self-abdominal massage with an
Mhm.
instruction sheet so you don't forget. Um,
Yes, those are always
and
helpful.
exactly. And then just follow-ups. I recommend the 90-minute like extended follow-up, but there's also like a 60-minute one.
Mhm.
It's more for what you need that day. So I kind of give 90 minutes, which is extra time to do extra things. So if you need a bone closing, if you need castor oil pack, if you need a spiritual bath, if you need a meditation, that gives you extra room for it. And then you could probably have anterior or posterior treatment or both. But the 60
Hmm.
minutes gives more time for like very specifically, like we just need to do like just the body work. And, that's okay. For some people, that's all you need. But typically, there's more.
It sounds like the
Typically,
90 minute
there's
would be more comprehensive.
it
But
is.
I could see where if time is a little bit of a factor or limited, that
Yeah,
if they were coming in for both acupuncture and Mayan abdominal massage, that maybe the 60 minutes and the 60. Of course, we'd
exactly.
love you to hang out with us for half a day, but you know, I
Yeah.
know time is limited for most people.
It depends on
Um,
what you need. Like I
yeah.
just the other day, like I had someone want in the 60 minutes the anterior and posterior treatment, but the moment I touched their body, I was like, I'm feeling anxiety, I'm feeling overwhelmed.
Mm-hmm.
And instead, we used the 60 minutes to just do the anterior work and work on a spiritual bath. And that is actually what they ended up needing more than anterior and posterior treatment.
Yeah. Yeah.
So like it's still possible. We play around with the time, but just know that like depends on what works best for you and just know the 90 minutes gives extra time to do extra things.
Hmm. Yes, extra time is always good. And we say in Chinese medicine that there's a connection between the heart organ and the uterus. There's an actual channel called the Bao Mai, which connects the heart to the uterus. So we always talk about how when there's an open heart, there's an open uterus or an open womb. So I think how you described doing some of the emotional, spiritual work is so important in this type of work. So I'm so grateful that this type of treatment is available because it complements what we do so well in TCM. And we just need more. We need more of that. We need more of that heart uterus connection and that opening, and really just kind of being able to access that soul level for us because we spend so much time in our head and in our intellectual self that being able to drop into that spirit self is just so needed and so cool. So
Yeah.
thank you, Caitlin. Was there anything else you wanted to share with us tonight? Any words of wisdom, any advice that you wanted to give? And then after this, I promise I will open it up to questions.
Um, I think one of the most moving things about this work that I learned when I finally was able to learn it and then now provide it, um, it is so interconnected to all things that I feel like after seeing and like understanding this work, it like fundamentally changed me as a person. I don't know if you noticed,
Mm.
Dr. Yang, but like
I sure did.
it it goes beyond body work, in my opinion, Arvigo Mayan Abdominal Massage, because it it's the physical aspect, it's the emotional, it's the spiritual, but I think past even all the other massage modalities that I've learned, it goes back into like your family history, your
Mm.
roots,
Mhm.
literally the roots of the lands that you live and the roots of the lands of which you've come from. So it asks you to look into like literally your history that's existed prior to you, like mother, grandmother, all these things. Um, and it asks you to like pay attention to your surroundings, not just like you as you live in your body, but you as you live in this world on this earth. And
Mhm.
that is something I think moves me deeply about the work because in healing yourself, you are learning to heal the world. And in many ways, we always hear that healing the world helps heal you too. So
Mhm.
I think now seeing that connection, this work is very, very important to me. And I welcome anyone who would like to learn and, even receive just a tidbit of information for it. Even if you just come in once and get like, the self-abdominal massage like instructions, like you'll be doing the work from home. You'll be tending yourself and can you imagine how many people you can heal in the world by just being healed yourself? Like,
I love that.
yeah.
That's amazing. I love that, Caitlin. All right. Well, so everybody, thank you so much for joining us tonight. And I wanted to see if you all had any questions. I know you were able to put it in the chat as well, but we'd love to open it up to some Q&A. Anybody? Or I'll just keep asking questions. No, I'm just
Me?
teasing. I'm done.
Question. I just have a comment. It was very fascinating. I'm interested in, I can't wait to go and try it with you for sure. And I'm hearing a lot of things that are connected to some of the things my grandmother did, uh,
Hmm.
Portuguese healer. Um, just, the prayer part, the massage, the abdominal massage. So yeah, I'm excited to come and try it out.
Oh, I'm so happy to have you, Denise.
Thanks, Denise. Anybody else have any questions? Anything you want to answer or share? Caitlin, anything I left out?
Oh, I think there's a question that has come up a few times of like why Mayan abdominal massage? And how does that kind of work when like I'm not a Mayan Yucatec woman?
Hmm.
And one of the things I think that my teacher taught me that I love that really extends through this work is that healing needs to move, it needs to migrate, it needs to be available for all people. And so often per practitioner, you get to invite in your own culture, and your like medicine practices too. So like for example, like Palo Santo, which I feel like a lot of people know in the wellness field, comes from like certain plants in like certain areas of the world. But like for me with like Vietnamese descent, like perhaps another plant would be part of that cultural aspect of prayer for me, like certain incenses and some and such. And that's something that gets to be intertwined with the work and being able to intertwine your own identity with the care is a way to ask for the healing to be global. Like literally, it can transcend all things that we see on the surface. And that's actually why like in the like in-person Arvigo workshop, I was able to like mix my like Vietnamese heritage in and I sang like a song around like that I would usually sing around like a fire at night and like get to like share that with everyone in the room because everyone comes from these roots, everyone has their own cultural practices. And so being able to integrate that, I think is so special. And so like that means healing extends in many different ways, like
Hmm.
beyond. So that's just a fun fact that I like to add in because it's
That's
fun.
really wonderful. Yeah, that's awesome. All right, everybody. Well, thank you so much for spending part of your evening with us. And we're going to release this on YouTube and as well as a podcast. So we'll make sure to send out the link if you want to watch it again or if you missed some of it. But yes, thank you again for your time. And yeah, we look forward to learning more from you, Caitlin, and hopefully you'll do another in-person Arvigo workshop as well, because that was really fun to
Yeah,
hear
I'd
you
be happy
sing as well as
to.
the demonstration of the abdominal massage as well, the self-abdominal massage. So thank you, everybody. Have a wonderful night. It was great seeing
Yay, thanks
everyone.
for coming.